over. Oh, hey, you can sit with us. Hey guys, welcome back to Skin Society. And this is episode 2. Oh, it is. It is 2. 2 for 2. 2 for 2.
Season 2, episode 2.
Season 2, episode 2. Look how fast that flew by.
Oh my God, I can't.
Thank you, God. Thank you, God. Because we are all here. Amen. But today we're talking about skin conditions.
We are.
So skin conditions have affected 1 million people worldwide. They will alter your mood, how you feel about yourself. They will make confidence. Your confidence, make you depressed. And I think a lot of times, a lot of skin conditions go untreated because they're undetected because your professional provider don't know what it is.
Lack of knowledge.
Yes, the lack of knowledge. So here's the thing. When we get these textbooks, I think that when we go over skin conditions, we breeze through it so fast that people don't understand that the clients that come into our treatment rooms, these same conditions are affecting their skin every single day. And when you think that you can just put a Band-Aid over something and let it go untreated, it causes more issues.
And just because it's out of our spectrum does not mean that you do not need to educate yourself on it.
Yes.
We may not be able to diagnose, but you should be able to
be able to say, hey,
symptoms. It could potentially be X, Y, recognize what you're looking at.
And another thing is too, like what I noticed, at least in the Black and brown communities, that people will let stuff just go. Like, it's like, my mom get this same dandruff. No, it's not dandruff, baby.
Yes.
Like, I think that we just so used to ignoring things instead of getting things checked out. Because I have a bunch of clients, I can't wait for us to get to the list, that come in with some of these different skin conditions.
Yes.
And I'm like, hey, that's running my family. It's like, because it hasn't been treated. You just have just...
And a lot of these skin conditions are, predisposed to genetic.
Mm-hmm. But it's like
it does run in your family.
Y'all all ignoring it. Yeah, y'all still doing it. Yeah.
My mama used Noxzema, so I'm gonna use that. It's like one of those things.
Yeah.
But I feel like with today's episode, I want you guys to pay attention. I want you guys to take our information and learn from it because you could be saving someone years of skin damage. So grab a snack. Let's dive into our skin conditions.
Get me back chips. Get me back chips over here.
Oh, is that what you want?
We ain't eat no chips.
We got
we trying to chip.
No, we're fasting, so no chips. So all right.
Oh, she fasted from chips. So nothing else.
Oh, all right. That's a good fast.
It's a good fast.
I can't give up
I know. So that's like that's big.
Yeah,
that's big. I am proud of you.
So let's dive into it.
Yes, let's dive into it. So, we'll talk about some of the things that we see in the break room, or no break room.
The break room.
I need a break.
in the treatment room, during our skin analysis, right?
Yes.
Things like seborrheic dermatitis is probably the most common one. Folliculitis, eczema,
rosacea,
psoriasis, keloid scarring. We see a lot of people with keloid scars. Fungal acne. And I think those are like the biggest ones, right? Like the ones that we can be like we see often.
Yes.
For rosacea acne.
Acne.
Oh, yeah.
Like the different levels of rosacea.
Yeah.
And even like the beginning stages of rosacea, like I'm pretty sure all of us can kind of look at a client and be like, okay, you're on the way.
Yeah.
You're on the way.
Yeah.
Yes. So let's start with seborrheic dermatitis and what it is. And
so it's a skin condition that is most commonly known in the scalp.
Yes.
It can also be on any part of the face that holds oil, like your face, the sides of the nose, the ears, the eyelids, the eyebrows, the chest.
Yes, definitely the chest.
It comes from like yeast.
Yes.
I can break it down probably a little bit better than that, but it's genetic. It can come from environmental stressors, but mainly from yeast.
Yeah.
It can be treated with like stuff that like products can be used for like with like tea tree oil, anything that's antifungal, antibacterial can help soothe, not treat. We have to be careful what we say.
Yes.
Soothe or calm. Yeah. But that one I see a lot here.
I think that also people ignore the signs. They like, I just have dandruff.
Yeah.
If your dandruff is scaly patches and like when you're combing your scalp, is like lifting up.
Tender
tender and it's lifting up. Stubborn dandruff, that you just went to the hairdresser and now 3 days later you have dandruff again. And our culture, Black people especially, we don't get our hair washed often.
Right.
We go every 2 weeks, maybe 3 weeks, sometimes once a month, because it's not common for us to wash our hair.
Heat, it was like that, but now I'm wetting it.
It's not common enough for us to wash our hair every day. So if you go to the hairdresser on Friday and then your hair has dandruff on Tuesday or even Sunday or
baby, you got a problem.
You got a problem, and I suggest that you see a dermatologist. Not dermatologist. But fear not, it's not contagious as what people think, but it does spread. Yeah. It can go from your hair
to your ears, to your eyelids, eyebrows. Yes. The areas that we said earlier, the chest. Especially, you know what's interesting about how it gets to the chest? I think it's like, just from like I can't figure out how it gets from.
It travels.
I know it travels, but like it skips the neck. And the neck holds like.
Yeah, but think about it, even when you're sleeping.
Yes. Yeah, but think about mold. Yeah. Okay. Bacteria grows in dark, cold, moist places.
So it's always
your neck is always exposed. So
right.
It skips
the neck.
I have this theory that it jumps to the chest from traveling down the back of your neck.
That's probably exactly what
and then you do see some people with like scaly necks, but it doesn't be as advanced as it would be on your hairline or on your chest. And you gotta think, a lot of women wear these tight bras, they wear these wrestling suits.
Yeah, like this. Just holding a bunch of sweat and moistness in there.
And that's how it spreads, and it lays dormant, and then they untreat it, and here's my thing. When it's dry and scaly in between the boobie area, they put oil on top of it.
Or perfume.
Yes, and you're festering. You feed in the fungus.
Have you ever seen it underneath someone's boobs? Yes. Yeah, it's crazy.
And even I don't have that problem because I don't have boobs. So when I wash up, it's just straight down. Okay. Like, I don't lift nothing up.
And if I sweat, I don't gotta be like, it ain't like
no lifting. No lifting. So when I wash up, it's just a straight down. I don't have to lift nothing or move.
So let's talk about what kind of differentiates seborrheic dermatitis from like atopic dermatitis. Or
atopic dermatitis is often triggered by some type of topical reaction to the skin. So atopic dermatitis, you'll see this a lot in the treatment room after you're doing a treatment or during a treatment, because a lot of clients' skin cannot just take certain things. You'll see a lot of atopic dermatitis once someone dermaplanes at home with a tinker razor, and then they slap some type of acid or oil.
They get all those little tiny bumps.
Yes. And here's the thing why that happens. You don't rebalance the skin.
That's right.
You don't rebalance the skin. Once you take away that skin must be rehydrated. You don't balance the skin before you throw acid on it. You don't have a buffer.
You need an occlusive to protect the skin.
And that's why you suffer from atopic dermatitis. So atopic dermatitis, which some people say is an allergic reaction. That is true. However,
atopic dermatitis and eczema is like the same thing. But
it's like, because eczema is a genetic disorder.
Right. So listen, for me, I feel like I've seen it maybe once or twice. People react to like certain products certain way, but it's their eczema was like non-active.
Yes.
And then they'll do something and they'll come in and I'll be like, ooh, what happened? What was different? What did you do different at home? Because I'm noticing maybe around the eyes. Like, so they did something that triggered the atopic dermatitis, but I think it's easier to trigger when you already have eczema.
Yes.
And it's easy to trigger.
It's easier.
Your detergent. It's like anything can kind of like give you that crazy reaction.
So, what was your question in the beginning? You said
in the treatment room, like, how can you determine the difference? Like, how, like, when I look at someone, like, and I'm saying, okay, it's atopic dermatitis versus, seborrheic dermatitis, and I think for me, it's more like you notice it in the scalp, right?
Yeah, I was going to say this. I can always tell that hairline in the scalp, and
then like you had mentioned, off camera before, like. You can even tell sometimes,
and they
got eyebrows, or even like their ears.
The difference, the vast noticeable difference, if the skin is scaly, if the skin is cracked, if the skin is white. If you have white, scaly skin on your face, you are maybe a carrier. I'm not going to diagnose because I'm not a doctor. You may be a carrier for seborrheic dermatitis. And atopic dermatitis is more like a
it's
kind of like a red.
It's
like erythema. It's red, and
it's y'all know what? My client just had it, so we're gonna insert a picture right here.
Can I tell you something?
What it looks like?
So a guy, client. He's not even a client. He's a Thank you. Mm-hmm. He's he was Tevin's brother-in-law. He came to our house, and I've seen this man 100 times, and I'm like, what happened to your face? Mm-hmm. But that's what he did. He went to get the barber, and you know how they do the dye shit.
That's why I hate the barber.
It was so. I kept telling him like, "Hey, buddy, that's atopic dermatitis." He was like, "No, it's just from this. I just had it like a little. I get red."
I just want to talk about that too.
Can I tell you, it was all in his beard, and then later I seen a client have that. And I'm like, "Hey, stop letting them put that dye on you, because most of the time they're probably just grabbing it from anywhere. That's probably cheap quality.
And then think about it, you just went to the barber
and you got shaved, and then you're putting a dye on top. Yeah, exactly. So the extension of Tevin's family, he ignored my advice, and I'm like, I know I'm not a dermatologist, but then he went to a dermatologist. They gave him a bunch of cream. It spread just from his beard all over his arm. His whole arm was red and inflamed. It was like, I felt like, don't touch me. Like, even though it's like, it was like, that's crazy. And I'm like, all this is from you dying, you letting them dye you after they just,
the body reacted.
Imagine dermaplaning and then slapping dye on top.
But that's what I was going to speak about with seborrheic dermatitis. A lot of it goes undetected in our culture because hairdressers, I'm not going to bash y'all, but a lot of y'all don't have licenses, and y'all have not
went the braiders and stuff like that.
Y'all have not went to cosmetology school to learn a different hair, because skin and hair goes in hand.
Right.
But just like skin has conditions, hair has conditions as well. Correct. And a lot of y'all don't go to school to learn these conditions, and y'all leave your clients untreated for years and years and years and years, so it finally affects the skin. It's nothing big to say, like, your scalp looks different. If you don't know, I say that all the time, you need to go to a dermatologist. Not because I don't know, but because by law, I cannot physically diagnose
and I want to make sure that I'm right?
Yeah, because
like,
I know what I'm educated guess. I'm making an educated guess, but
based off of my experience, what I've seen in my treatment room.
Right.
But along with that, with hairstylists, right? Alopecia, because we forgot to mention alopecia.
And it's becoming more common in the Black community.
Yeah, 100% of alopecia.
It's becoming more common, and I think that if you take the time to say to somebody,
I'm about to say
if you take the time to say to your client, and this is how you say it, without sounding like I'm a doctor and I'm diagnosing you. I'm not a doctor.
Literally
start with that.
That's literally what I say. I'm not diagnosing you.
However, I know if this is what I think it may be.
And I tell them, with my experience, what I've seen, this is what I would like for you to
know. I still say that, but I do the opposite. I'm like, listen, okay, so after evaluating you, I'm giving very much doctor, and I'm like, but I'm not a doctor.
I'm not a doctor.
And I'm just going off of what my experience. I say all that, but I don't leave when I'm not a doctor.
No, I say it straight off the bat. I'm not a doctor. I'm not diagnosing.
Especially depending on my comfort level with that client, how long I've been.
Yeah, if I haven't seen you, I'm like, bitch, you need to go get that.
I don't know what that is. I think I know, but
and then I follow up with, if you come back and tell me what they say,
I can treat it.
I will get you whatever. I will get you whatever you need to treat it.
Yeah.
But I cannot treat something
without
I don't
confirming
that
what
that's
it is.
what it is.
Can I just throw in, this is part of the trade show. We learned this at the rosacea class that we took.
Yeah.
With that, I think they're for France, right? The company was from France.
Canada, I think.
Oh, Canada.
Okay.
They spoke French. Didn't she speak?
Well, she spoke French.
Some people in Canada come from the French Quarter.
They do, right? And they speak French. So,
yes.
I was going to Jordan. Yeah, I'm like, I swear she was speaking French. But she mentioned during the training, basically, that, like, because it's out of their spectrum and there and obviously here too, they don't say like, oh, we're gonna treat whatever you have. Is no, we're gonna soothe the symptoms. So I think I kind of like to adopt that for us, right? We're like we're in the treatment room. It's like, okay, you go to the dermatologist. I think this is what it may be. You go to the dermatologist, see if you can get a proper diagnosis, and then I can help
work on soothing the
symptoms. Because we cannot treat.
We can't treat.
It's out of our spectrum. So I just wanted to throw that in there. That's very reminded me of that.
Very important. And then another thing, I don't think that we have this on the list, but I think it's tinea versicolor.
Yes.
So that's
a good one.
That's a really good. It is. But what I noticed, just thinking about the atopic dermatitis and how his arms looked, it almost started to look like that.
Well,
it was like big. Patchy, so that's another one I think not maybe in this episode.
But that's a symptom of it, is the regular shape.
Yeah.
The regular shape.
And I know you was mentioning on the arms.
Yes, and I think that is actually good, because I think that for some people who do have that and it's not really like, it doesn't look rashy.
Yeah.
It can be mistaken potentially for vitiligo too. Because that kind of turns your skin hypopigmented. Hyperpigmented.
Yep, and it just be like little rings on the body. Like I've seen it in people's necks.
But it's
like
another contagious disease too that spread commonly among
and that's from yeast too.
And that's impetigo. So impetigo is like a wingworm, but it's not a wingworm, but it's most commonly found in children. And guess where it lays dormant at? The ears, the nose, like the little, like the ring around your nose. If you have kids with crusty noses, sometimes That's what it is. And that is contagious. So if you see a client with that, you have to send them home. Let me tell y'all something real quick. If they come in with a bum bump.
With a bum bump.
That's a no. That's a no. If they come with ringworms, that's a no. If they come in with avocado, that's a no. You send them home like all money, because here's the thing. You don't want to just touching them with your overall extractor. You think you just throwing it in barbicide is going to kill the bacteria? No.
You got to put that thing in the light.
You got to put that thing in the
trash.
It's not worth your practice, because here's the thing. Now I'm going to tell you real quick about insurance. If you knowingly treat someone with an infectious disease, and you know they have it, and you try to skate past it, and that person goes off to tell somebody else, they can come back and sue you and your business, and you will lose your license for treating a person who has an infectious disease
and is active.
And not to mention, you're possibly spreading that shit to yourself.
You're not even spreading it to yourself. You're going to take it home to your babies. You're going to give it to your husband, and you're going to give it to other clients. And if other clients get infected because of this, consider yourself as whatever you are. Done.
Absolutely.
Yeah, I think it's very important in our industry to value sanitation and disinfection.
Yes.
Like, that is key. Knowing your bloodborne pathogens, like, having things in the studio. We should do one on disinfection and sanitation, because it is very important. You know what we are.
Yeah.
We'll do an episode on that so we don't get sidetracked.
Yeah. But I was saying that tinea versus color also is from the overproduction of yeast.
Yes.
On the skin.
Yes.
And that's like, I'm like, and it's like, you don't even think about that. Like, it's like how much yeast can be on the skin.
Yes.
But what I need to know, maybe you guys have the answer to, like, what causes the overproduction of the yeast in the skin? Like, what?
Wearing hoodies all day, you get out the shower, you lotion the body up, you slapping Vaseline, Aquaphor, cocoa butter onto your skin.
Or can the opposite be true too? Like, getting in the shower, taking a shower with like body wash, and stripping your skin and then not moisturizing afterwards.
Yeah. Two things can be true and two things can be false at the same time.
Yeah, I really want to get to the bottom of that.
However, when you have yeast and you let it go undetected or untreated, it festers and it lingers. So if you notice something is not right, that's like me. If I feel something on my skin and then the next day, wait a minute, this is still there, I'm going to the doctors. We have to stop being afraid in our culture, in all cultures, to stop going to the doctors.
Yeah, that's what I was saying. We'll go and let it. Oh yeah, my mom had it. It's like, no, okay, so go to the doctor.
To go to the doctor.
Yes. And I noticed a little bit off topic, but another thing I noticed in the Black and brown community too, we'll wait until something gets fucking deadly before we go to the doctor.
No, not me.
You know what I'm saying? But like, for example, I work for a cardiologist, and you even probably with a dentist. You in dentistry, see people come in.
People will come in, and then tooth is falling out, and you blaming you because they gotta get their teeth taken out. Yeah.
So, and also from our research, they say like a lot of these skin conditions are primary in like African ethnicities, like cultures, and stuff like
eczema,
that. Yeah, exactly. So, yes, genetically, you're also predispositioned to that, but
that don't mean you
I think what I've noticed in all of them, right? All of the ones that we're going to talk about, because we still have to talk about rosacea, but I think it's safe to say that all of those, although like environmental triggers are, a thing, genetic too, most importantly is lifestyle. If you smoke, if you don't eat properly, if you don't have an anti-inflammatory diet, because a lot of these skin conditions are inflammatory responses that your body is having. So it really comes down to gut health and overall lifestyle.
Yes. And another thing too is like, even though it's genetic, right? Like, for example, like two of my siblings have allergies. I don't have allergies. I'm not allergic to nothing. So even though it's genetic, it's something that you're doing in the lifestyle that can be triggering.
Correct.
The flare-ups, you know what I'm saying? Like,
especially with eczema.
Yes, I was about to say that.
If you're stressed out.
And rosacea.
That's what I'm about to say about rosacea, because rosacea is common in the Latina community.
Very.
So when I see someone that, I'm like, did you just have liquor? Did you just eat something spicy?
And we love spicy, right?
And I'm like, you just had something spicy. And they be like, I said, that's why your cheeks are rosy red. Your capillaries are inflamed because you just had something spicy. And they be like, oh, I never even thought about that. And I'm like, yeah, they go down in 4 or 5 days. Like, because it's a trigger for Latin clients. So rosacea is one of those things, though, but it's no cure for rosacea.
There is no cure for rosacea. Rosacea is just like acne. Yes, it can be, we can soothe the symptoms of rosacea, but there is no cure for rosacea. And typically, people develop rosacea later on in life, too.
Yes.
It's something that kind of comes with age. And there are different levels of rosacea. You have, grades 1 through 4, I believe. And when you get to grade 4 is when you get, like, the real nasty looking noses, the form.
Right, yeah. That I've seen that clearly.
I've seen it in the older
grocery store, but I've never seen it in here.
No, either, not in the treatment room.
Yeah, not in the treatment room. But what I wanted to say is, so I have a new client. She came in for a consult, and she's coming to see me next week for a treatment, but she's black, but she's in the lighter skin. She's probably about a fit 3-4.
Okay.
But she was like, yeah, like, I always get really red. And I'm looking at her skin, and I'm like, I don't want to be like, you have rosacea, because, you know, but it's not like extremely red, but I can see it starting to like come. So I'm looking and I'm talking to her about her skin, and I'm just like, does anyone in your family have rosacea? Because, you know, I'm like, yes. And because she's a new client, I'll let her, like, I'm not a doctor, but from what I see in my treatment room, what you're explaining about your skin and what I see from not even just taking you in, it does look like you could possibly. She was like, do you know I went to the dermatologist and they said that doesn't happen in black skin? And I was like, I said, stop playing. I said,
I wish it was.
Yeah.
I'm like,
yeah. I said,
that dermatologist,
and she's like, that is not common in black skin, so she thinks it's something
okay. Common does not mean it does not happen.
Yeah, I'm like, and she was like,
that's
she
very
said
like,
they asked her basically like, does it run in your because no one has it? I'm like, but you could
because someone
but you can develop
exactly. And that's so I was asking her like about her lifestyle stuff like that, and then she was just so happy. When she left, she was like, I cannot wait to come back. She was like, because I know it's that. She was like, and she's like, I'm not happy that you're telling me that it's a possibility. It's that. So I can't diagnose it.
But now we know.
But she was like, but now I have comfort knowing like, okay, it's probably this, and I'm like, I'm gonna treat it and like I'm trying to soothe like it's that, and if it starts to get better, that'll be kind of our confirmation. But I still want you to go to a different dermatologist.
Yeah,
you know. But it was crazy, and they think that like how they program to think that it's only in the white or Latina community, like, but no, anybody
like it's more prevalent in our community, but. I've seen it. I've seen it on the darker skin.
She was my third black client with rosacea.
Oh wow.
She will be my third.
But just because you're
client.
Black on the inside or the outside doesn't mean the genetics are fully black. That's why we all
and especially
are
when they're in lighter fits.
Yeah.
Because like, you know, just like for example, like if you were to treat an Asian person, you still gotta treat them like they black because they hyperpigmented.
Correct.
You know,
and melasma is something that. Oh, you know what? Melasma's not even on our list, but melasma is one that's really big, especially in Asian community. Yeah. Like they are very well known for having the melasma mask.
Exactly. So what's next? We talked about atopic
folliculitis. Because I see a lot of people with folliculitis, especially since I started waxing.
Really? Oh wow!
Since I started waxing, I see a lot of people with folliculitis. I don't think people.
Is it the waxer fault?
I was about to say.
So yeah, I will. Okay, so yes and no, right? Because obviously, like with waxing, if you're not properly pulling the hair from the root, you're causing breakage, and people with folliculitis are more prone to ingrowns anyway, right? But at the end of the day, it's still fungal, right?
Yes.
Folliculitis is still fungal, and it needs to be treated with either like something antibacterial, some type of benzoyl peroxide wash or something like that. But I think that it can be confused with HS.
Oh, but that's a difference.
Which is hydrogenitis suppurativa.
Yes.
And I see that a lot
HS,
as well. Yes, that's short for HS.
And that affects the underarms as well.
Yeah.
Yes.
And I see a lot of clients, and also in the inner thighs.
Yes.
And I do want to kind of hone in on those because I feel like between folliculitis and HS, I feel like it's so common, especially in Black and Hispanic community, but not talked about because it's so...
I think it's they're embarrassed.
Yes, because it seems like, you know, it happens literally in here in the groin area and like underneath in between the butt cheeks, and it's painful. HS is painful. HS is a condition that your follicles like get inflamed, right? And eventually it becomes cysticky, boils. Some people get it so bad to the point where like literally they can't bring their arms down, like they can't function, do normal day-to-day things because they have a flare-up. Like, could you imagine a big old bump in your groin area and you're trying to walk, you know, like it's uncomfortable. And then like you said, embarrassed in the sense of like during intimacy.
Yes.
People are like,
because you don't know what the hell especially like a guy might maybe not know. So I haven't had a client, but I had like Timmons family got like going on. So, but like one of his nephews, my nephew, I love him, but he was like he couldn't walk, and I ain't know what he's like. Yo, he was calling me, but I was working, and then he was like it popped, and I was like, what? He was like, I had like this ingrown hair. He's like, it was like a boy. He said, and when it popped, that shit stank so bad. I was like, that sounds.
And can I tell you what?
Yeah.
You know what's the biggest triggers of HS?
What?
Overweight and smoking. He do both.
He do both. He do overweight.
She said, I'm gonna text him.
Yes. I'm gonna text him
Those two are the biggest triggers of it, specifically HS. Like, if you are overweight and if you smoke, that's gonna automatically cause a flare.
Yes, it
like
does.
100%.
But I feel like it triggers emotional distress. It triggers stress, and that's why it can commonly lead to acne as well. Because it's like
your cortisol levels are like
the symptom is combining with something else, and then you have a new symptom.
Yeah.
And it's going left untreated. So then you're trying to figure out, why is my face breaking out?
Yeah.
But because I have this and I have that. But the thing is, go to the doctor. That's the best advice that anybody can give someone. Is just go to the doctor and figure out why your body is doing this.
Yeah.
And it's genetic. And once you understand that it's genetic, I think that a lot of people will take it for a grain of salt.
I do. And I think that, like, just like with acne, right? Like, once you start doing the things that you need to do, everything is going to fall into place. Like, you'll start to notice if you start to lose weight and your symptoms start to, like, decrease, then you know, like, obviously, like, I can't get past a certain weight before it starts affecting me, you know? If you stop smoking and then it gets better and then you start smoking again and it triggers it, then you know, all right, like, this is a big no for me.
Yeah.
Right. But needless to say, it comes down to lifestyle.
Everything comes down to, it's always your lifestyle.
Your overall wellness.
Skincare is just fun.
Put it's stuff on my face, and that's it. And it's not.
It's a lifestyle change, and that it's not just a treatment. It's a lifestyle that you have to adapt to.
Sorry, but that wasn't him. That's a contractor. It's just so much. My phone, I forgot. I thought we would be done, but we was delayed because of traffic. And stuff.
Yeah.
So everybody's like, "You said a call at 1 o'clock." I'm like, "I'm so sorry." Like,
Go ahead.
No, I'm sorry, but yeah, I'm gonna text him that too, though.
Okay.
I started to text him and I seen I had a bunch of
yeah.
Okay. The next condition I want to talk about is keloid scarring.
Yeah. Yes.
I don't think so. Keloid scarring is really because
it's like an overgrowth.
We don't know why it happens, but somehow genetically, when your body has a scar or has trauma, it starts to produce new collagen.
Right. I think it's like an overproduction.
For some reason, why the body produces too much collagen and it doesn't know when to stop, and that's why the body has these raised type of scars after the trauma happens.
Right.
I think a lot of times keloid scar can be prevented.
With like
proper care.
I'll say proper care, like when like, for example, I'll let you finish, but then I'll show you my leg.
Yes, I think it can be prevented if people know that they suffer from the keloid gene.
Yeah, and if you have common in black skin.
It's very, very common in brown skin. But a lot of times people will see a client with a keloid and try to test the waters. Oh, you got a keloid on your finger.
Let me
microneedle you.
Hell no.
You got a keloid on your hand. Let me dermaplane you. You got a keloid. No. Let me go too hard on this pimple, you know? I think what keloid scarring is one of those things where you have to put safety over the client.
100%.
Over trying to get a good Instagram photo.
Yeah.
And with keloid scarring, it is treatment for it, but you have to pay for it. Like, it's no, like...
I'm sorry, what?
It's no magic cream that will get rid of the overproduction of collagen.
Inject it.
Yeah, I would say they do steroid injections. I have a client.
I had steroid injections on this scar here when I first had it because it was very keloid. Like,
and I had a client, honestly, she went to a dermatologist, and a dermatologist had an esthetician, and she wanted to get microneedling done because she had a keloid behind her ear. I told her not to. I said, I don't think that's a good idea.
That's not even an effective way to treat a keloid.
What happened when after she got it microneedled, yes, it went down, but the whole back of her ear is so white, you can see the veins. It's just clear.
She lost pigment.
She lost the pigment.
Fix that.
She lost the pigment, but you can actually see the blue and the red veins. I'm gonna show you a picture of it. It's clear.
Lying to me.
Behind the ear is clear. Like the skin.
So what? It like thinned out the skin
completely
from microneedling.
Because she's keloid prone. It killed the skin completely.
That's crazy. They must have did something else with that.
And I told her not to do it. But the thing is. You went to a dermatologist,
and then
but they don't care. Okay, because let's say that, right? Dermatologists, and I have clients who I've sent to the dermatologist for a mole, and they will go get it removed. And when they come back, it baffles me every single time because I'm just like, dude, how do you not care about how someone's gonna scar?
Yeah, they just do anything.
It'd be so simple. Like maybe like the incision will be this big, but like. When I tell you dermatologists will butcher it.
Yeah, it's like now the scarring is worse than what you removed.
Yeah, you might as well have left the damn mole.
Yeah. So my client that has the keloids, right? I referred him to a dermatologist, and they did a bunch of injections, but it shrunk them really nice. I was like, okay, so I know that's one way,
but
right?
that works.
Yeah,
I've had that done,
but not to microneedle. A keloid.
No,
that's
crazy. I would never do that. I don't even if it was allowed.
But
it just
can we
doesn't
talk
sit right
about,
with me.
since you do this too, Procel?
Yeah.
So the reason why Procel sold me was because when we went to the trade show, Procel said that I could Procel keloid scarring.
Yeah, but I think it's to a certain degree.
I'll tell you one thing though.
Yeah.
Procel flattened.
Yeah.
This.
Yeah.
A lot more
than the injections.
Well, the injections made it pretty flat.
But
when I was microneedling, I would microneedle the area just because I was testing the waters. But it didn't do anything.
Right.
When I got the Procel treatment, this flattened a lot more than it was prior to Procel. So maybe not like super crazy keloid scarring, but something as small as mine would be okay.
Say, so like even like with small ones like yours and like even mine, I think that cryo.
Have you tried to Procel that?
No, because it's a plate.
So
underneath it, I'm scared.
No, you don't feel that. That's it. You feel that?
Yeah.
You feel right there?
Yeah. Yeah, I feel every single thing.
What?
That's why when she scratched me, I said, "Stop scratching my leg," because it's even more sensitive. Like
really?
I cannot feel
because you got nerve damage. Even though my nerves are damaged,
I always thought like if you cut the skin and you have a scar, if you automatic, that's crazy.
I feel that shit. Yeah.
But you say you feel everything too.
No, I don't feel anything on this. My nerves are dead. No,
you don't even feel yourself scratching it?
No, I feel like. You know how like when you go to the dentist and you get numb, you know something's touching you but you don't feel it. That's how I feel.
So when I'm scratching right here, it feels the same as when I'm scratching right here.
No, oh, wow.
It feels the same.
Like if you scratch, like even when like dermaplaning or what, if I for some reason if I dermaplane here, I swear like it like shoots up, but I feel it like up here.
That's great. Oh, your nerves.
Yeah,
your nerves.
Maybe that I don't know. I just always assumed that when you're cutting.
But you know, not
through, you're cutting the nerves.
Yeah, no, because you know they remend. Have you ever got a paper cut and then instead of like trying to like go get a Band-Aid or whatever, if you press your skin together, it can remend.
So
that's why I say,
yeah. But that's what happens when. So I don't know if you guys noticed, but whenever you have a client who has a lip blemish or ear blemish, why the skin doesn't form back together? The skin doesn't form back together immediately because it loses the blood supply, the oxygen flow. You need blood supply. You need two things to heal a wound. Blood supply and oxygen. Yeah. If you lack both of them, the hole remains open. That's why when we get our ears pierced, it's no blood supply or oxygen once we get the hole.
Right. Oh, that's why like when ears split and stuff like that.
When we get our belly buttons pierced, once you put the hole, the piercing through it, is no blood supply to oxygen.
That's why it doesn't close back
the healing. So you need two things to promote healthy wound healing: blood supply and oxygen. And you lack both of them, the hole remains. So when you have clients who have blackheads in their ear and they don't bleed and they keep getting them and keep getting them and keep getting them. It's going to create a hole. Same thing with the lip. Remember your client with the one with the lip, and she still has the hole.
Yeah, that's a pore winder at that point. Dilated the damn pore,
and it's just accepted to come and more bacteria to grow in it. So
so I have a client who gets a blackhead like right here, and I'll get it out, but it's like just a hole. It's like, it's like a pit.
It's a dilated pore.
Yeah.
They left that blackhead in there so long.
So now
stretch it,
and pop it out. Every time you pop it out, when you come back, the hole
is right there. It just gets.
And you know how do you fix that?
What, microneedle?
TCA crossing.
Oh yeah, you said that.
But you have to create a controlled wound first. Once you create the controlled wound by microneedling, my best advice to either prick the skin with a fine like a gauge. What is it?
A needle.
A needle. Yeah. Prick it. So you get a little blood supply flow, and then you put the TCA pill. You inject the TCA pill right inside that little hole. You tell them it's going to form a scab. Do not pick this scab off.
Right.
When the next time you see them in 30 days, they're going to have collagen there. Yeah. Then you rebuild to fix that point of collagen.
I actually have an appointment to Procel her. My wrist just carpal tunnel.
Yeah.
I got an appointment to Procel her next week, so I'll
Lancet. You pick it with Lancet. I'm sorry. I was trying to find the word.
I want to say it's a Lancet.
You Lancet so you get blood supply, and the moment you get that blood supply going, you pill it. You put the pill on top first, and then once you put the TCA, you could do TCA 15. I wouldn't go no higher than that.
Yeah, I don't own anything TCA higher than 15.
I think I have what's the Glymed one? A 10?
That's 15.
15. Well, do TCA 15.
Skin scrub is 10.
Yeah, I think I have the Glymed.
Put the TCA 15 on it. Do 2 layers, and she's gonna get new collagen. She's gonna have that whole.
But I was gonna say before we jumped onto the to that part of the pore about the keloid scarring. cryotherapy on a keloid small enough.
Yeah.
The nitrogen, the cryotherapy helps with the keloid scars as well. Yeah.
I just try to like baby walk it as much as I can because I don't want nobody saying like, oh, you did this or that.
No, not for me. What would cryo? I would send them to someone.
Yeah,
but like,
I just try.
But for this scar, right?
Yeah.
You see how like it's a scar tissue there, but it didn't raise. You know what I did to?
Did you have staples?
I had
stitches. Those were stitches.
Yeah, this was stitches. I had stitches. Can I see? I had staples on my stomach. I'm all.
That's stitches. I can tell by the way that it's
so hard near me. So this is this was stitches. But you see, it goes. You can't even tell, but it goes all the way up here.
Yeah,
it's so flat because what I would do is put patches on it to keep it flat, and then you got to massage. So like keloids get out of hand because people don't treat them.
Yes.
So the moment this scar started to heal and it closed, I will massage it daily with oil because you got to massage the scar tissue. You got to break it down.
Flow.
You got to break.
The reason why it healed that like that, they stitched under.
Yeah, like I don't remember.
The stitches were that
under. Way they did this one.
They weren't on top. Yeah, the stitches were
I
under.
Remember how it
That's
was.
why your scar is like that. That's why it's like skin over skin.
Yeah, instead of
those. Yeah.
It's like braiding.
Yes.
Yeah. I don't remember how it was.
When everything is so advanced now, they have glue that you
you don't even get stitches.
Yeah, it's back together.
But it's so smooth. Like it gets a little texture down here, but
girl, you should totally pro-sell that.
Yeah,
because of the bone. Just because the bone. That's just
and even just for like a before and after, because when I tell you that can look like when people get tummy tucks.
Yeah.
You know? And then that's something within our spectrum that we can treat.
Yeah.
You know?
Yeah. You know, when I first got it, and you know what else, believe it or not, helps with like tummy tuck scars? Freaking the chemical, the VIP. Girl, I'll show you.
Or Procel. Yeah, I had a Procel.
I'm gonna
people don't know that I do this because I'm gonna
promote it.
I don't promote it, but I do scar correction.
Yeah.
And I had a client who had Brazilian butt lift and the little 2 butt cheek scars. I like Procel, her butt cheek scars, and they're not there, so no one can tell that she had Brazilian butt lift. But I don't talk about that I do it because I
don't either. But we totally.
I do butts all the time. But nobody wants their. I might like do like a little boomerang, like you see a little bit of cheek.
Like I don't talk about I do vajations, like because that's not what I'm. Yeah, I just don't want coochie land over in here. Like,
we are gonna do an episode on vajations, though, because that is a whole topic within itself.
Yes,
and very important.
Yeah,
but I just don't talk about it.
Yeah.
Like,
yeah, I always like to say, like, you know, as estheticians, like, if you have skin,
we can fix it.
You have it from head to toe. Like, you know, we do promote facials and like bag facials and things like that. But there are areas of the body that we work on that we may not promote. Like,
remember I kept on my toes.
Yes. You did.
Yes.
I had like a little scar.
So you know when you wear your sandals and the sandal rubs against your skin and it makes that big black scar? Who wants to walk around the summer like that?
You know what sneakers did it to me? I've never worn these again. I wore them one time.
Golden Gooses?
No, but it was popular. The freaking Alexander McQueen sneakers.
Oh. They looked uncomfortable.
They are hard as a fucking shit.
Yeah.
But they were rubbed against. I wore them one time out. Mm-hmm. The next day it was super red there. And then next thing you know, it turned black.
It blistered.
It didn't blister. It just turned it black. Yeah. I gave it to my mom. I said, here you go.
Yeah, you can chemical peel it.
Yeah.
If the pill works on the face, it works on the body. Yeah. The only thing difference is with the body, you don't feel the strength of the pill. Like so you can just keep layering on, but you have to know when to stop.
Yeah.
Just like with stretch marks, we treat stretch marks, but I don't promote that I treat stretch marks because.
Yeah, I don't.
Everybody everybody got tiger stripes.
So everybody, if they ask me, but I'm not going to put like 1,000 services.
Because that's not my. I don't want to be. First of all, I'm overworked as it is, and second of all, I don't want to just wake up every day and it's stretch mark treatment. Yeah, that's not fun for me.
Because my passion is more hyperpigmentation and acne. Yeah. But let's talk about eczema and how we treat eczema. Well, soothe eczema.
Y'all want to know my secret treatment to eczema that I tell everybody to get? Go to Target. It's a company called the Honest Company.
Honest brand?
Honest brand. Yeah. They have an oatmeal colloid balm. Mm-hmm. You use that for eczema. That balm is and this is why I tell people to use the oatmeal colloid. Oatmeal colloid is very soothing on the skin. Mm-hmm. Eczema does not need to be inflamed past what it already is. Right. Oatmeal is very soothing. Gliomet makes one. Their
body one?
Their cell protection balm.
Oh, I love that.
Same genetic makeup. And when I did the research, got the MSDS sheet, same product, just one for babies, one for adult. I tell people to get the Target one because the Target one is $15.
Yeah. It's a big bottle.
It's a big bottle.
Yeah.
The Gliomet one is $80. If I already know you suffering from eczema, and this is something that you're going to have to be slathering on every single day,
come on.
Go get the one from Honest Company and Target.
And that is integrity. You know what I'm saying? That's integrity. That's because it's like you can easily make money off it. You're not making money off of the Target product.
But I want to help you.
I want to help you. I want to help you.
Me, it's CBD.
Yeah.
CBD.
What, like the
massage bomb,
but even just aside from like what we sell, like CBD period.
Yes.
God bless you.
Thank you, sir.
CBD, I feel for a lot of skin conditions, it's very underrated.
Yes. But it's expensive.
It is expensive, but I feel like CBD can treat so many things, right?
Yes.
Eczema, psoriasis, rosacea, if you have arthritis, it's just an anti-inflammatory. So when I have clients with eczema and stuff, they'll ask me like, what? And I'm like, CBD. I do. The Honest Bomb is one of my go-tos.
Yes.
And not just for people with eczema, right? Like, even for like when people have like a little like rash or something, like it's just soothing. It really helps.
And here's the thing: what also people mess up with, they think of a skin condition, and the first thing they go out, they run and get an ointment. Ointment contains oil. Oil and water does not make. This goes back to biology 101. This goes back to podcast 101. Do not put oil on the skin. Oil is chronogenic. It will cause other issues to arise. If you ever get a cut and you need Neosporin, choose the Neosporin cream over the ointment. Always cream over ointment, because ointment contains oil or some type of beeswax substance. That, yes, it will soothe the skin, but you will have some type of flare-up or breakout from the overproduction of sebum with dead skin cells, and that's how you get acne. Always choose some type of healing product that has a cream base over ointment. Now, if you in Dubai and you don't have no other choice, get the ointment. I don't care what you get, just to get back to the United States, because it's very different. But if you're in America, you can get a cream-based healing product, get the cream base.
I meant like, what do y'all use in a treatment room?
For what?
CBD?
Yeah, you said CBD. You was talking about the...
I use the, honestly, the Glide Med because I don't want anybody coming to my space and like, she's charging this much for her facials.
So I do their CBD.
Yes, I do their CBD.
Mask. I do a little cocktail. Depending on, like, if their skin is very inflamed, I won't use the oxygen. But if it's not, like, I'll put a little bit of the oxygen in there and the peptide. The peptide rejuvenation, their mask, because there's something in that mask, I don't know what it is, but it's just so soothing.
And also, if they have eczema, I don't use the aggressive exfoliator.
I try not to even exfoliate.
I wanted to go ahead.
I cut the exfoliator with the ultra hydrating enzyme mask, the green one. I cut that one and I put I use the oxygen powder, I use the hydrating enzyme mask, and then I use the oxygen wash, the oxygen wash, the oxygen powder, and then I use a pump of the oxygen pill, just one pump, just to get some type of exfoliation.
Because that was only 5% lactic.
Yes, to get some type of exfoliation going. So I cocktail a treatment for eczema clients.
And you know what I have been loving? I'm obsessed with it. That beta glucan serum.
Oh yeah,
from nice.
No. From the Korean people.
Listen, I'm not talking about them because those are our plugs, and
I know, but let me tell y'all
something. I'm keeping something for myself.
I wanted to tell
I'm gonna buy like 20 bottles of that shit, okay? Because when I tell you, every client that I have laid that on, whether they have redness, irritation, even dryness. No, it's like it's a little silver bottle.
I'm leaving here with something.
It's the mask you got, but the serum. You got the mask.
Yeah. Okay.
Just the serum.
Yeah, I was about to say, so I use those. So that's all I was about to say. So what my favorite thing lately has been, so when before I started working with our plug, I was using a bunch of the Restore Serum from Hydrinity. And look, this is one of my clients. This is not eczema. This is psoriasis. But this is, look.
Oh, wow.
That's after using Hydrinity.
Oh, wow.
Amazing. And this is non-consistent. Yes. This is her using it a few times. The one I was telling you about, using it like here and there. But look at the big difference.
Wow.
Yeah. You know? This is from just the hypochlorous acid spray and the Restore Serum. So I'm using, I'm almost using the serum as a mask.
Yes.
I love that.
On their skin. I'm loading it up, right?
I love that.
So that was one thing. But then I started using the chlorophyll treatment. For rosacea. For eczema. For like any type of barrier.
Did you see that I sent you the thing? They paired it up with BioRefill?
Yes.
I sent you a thing on Instagram.
Yeah.
No!
In the group chat, yes.
No!
They paired it with BioRefill.
What?
Chef's kiss.
What? Oh, I can't wait to see that. Girl, I'm
gonna send it to you again.
Yes. I can't wait. That's gonna be good. That's gonna be so good because I have a client who wants both, and I'm like,
girl, they paired it. I was like,
mind blown. Okay, I can't wait. But yeah, so that's what I've been doing. Like, I'll just hyaluronic acid. Hyaluronic, and I've never thought that it would work that well. But like even with my clients who,
you gotta think about hyaluronic acid in retrospect. Hyaluronic acid is a molecule that we're all are created with.
Right.
As we age, we deplete it.
Right.
So if that same molecule gave us nice dewy skin before we hit puberty, what makes you think that it's not going to give us that same type of skin as we age and get older?
This is my thing.
It gives you that suppleness.
Yeah, exactly. Right. So when I see either eczema or any type of compromised barrier, the first thing I'm thinking is trying to like wound heal it, right?
Yeah.
But what bothers me, what gets me is if I think that, and I've only had to go to school for 6 months, why aren't the dermatologists?
Because they don't care.
I don't know if it's that they don't care
they don't care.
They just think. I think they might think. Because, hyaluronic acid is something you can get over the counter.
Yes.
I think that they think more so, let me prescribe this because I get kickback.
But sometimes they don't prescribe at all.
They'll tell you, like, go get serum.
I have learned working in the medical field, honestly, I'm only here to charge you, and I'm on to the next client. I'm on to the next patient. So that's why we overbook our schedule. We overbook our schedule with so many people a day because I know all I gotta do is pop in here for 5 7 minutes.
You talking about when you work for the doctor's office?
When I work for the doctor's office,
yeah,
not me, because I'd be like an hour, 2 hours with people.
Yeah.
But when I work in the dental office, the whole goal is to meet our quota and to meet our goal and to pay these bills and be able to pay your employees. I don't have 2 hours to spend with one person a day.
Right.
That's why you may walk in the office and the doctor may be like, "Oh, you need 4 root canals." Okay, schedule a root canal one by one.
Yeah.
Because I only have 20 minutes to give you out of this appointment because I have 50 other people to see that I can only give 20 minutes to. Dermatology is the same way. That's why they don't touch. They look,
which is beyond
and
me.
They don't
crazy.
treat.
Yeah. So, but what I was saying is like sometimes, like some of my clients, like the psoriasis, they give them a bunch of steroids.
But that's depending on your insurance as well.
No, yeah, they're giving a bunch of steroids and cream, but it's like
it's a Band-Aid.
It's a Band-Aid
because you're just
especially like
slapping it on.
How do you feel about put your Aquaphor on or Vaseline on your eczema? I feel like it's an occlusion. I feel like it might soothe the itchiness and the irritation, but it's not.
But they telling people to do that.
Yeah, that's it. But it's like,
but that's anything in dermatology, right?
Crazy.
When they go get treated for acne and they put them automatically, you got 2 pimples. Oh, spironolactone.
Yeah.
Oh, you got to drink this. It's gonna balance your hormones. Like, yeah, you're just putting a Band-Aid on it.
You Cetaphil. No, Cetaphil causes
cancer.
It's easy for them to say go use this because guess what's going to happen? The moment you leave the dermatologist's office, you're not going to come back the next day. The Cetaphil broke me out.
Yeah.
It's because it's nothing in it to do anything for your skin. It's no product in it to make. It's no actives to make it do it what it's supposed to do. And when people talk about is no such thing as medical grade or professional grade, there is.
Yeah.
I hate when dermatologists get on these platforms and say it's no such thing because trust me, if you go use Cetaphil and you try to compare it to something that's like Glad Med or Face Reality Cleanser, they're nothing like the same.
And not even that it has to have medical. It's the quality of how it's produced.
Yes.
Where you think about Cetaphil, serum, they're mass produced.
We talked about and we talked about this in our previous episodes, right? Where like they are mass produced versus our products aren't, and there's consistency.
Right.
But also professional or medical grade products have to be 99% pure.
Exactly.
And they have to be backed by clinical trials.
Exactly.
What you're getting at Ulta, what you're getting at Sephora, what you're getting at Target only has to be 77% pure. That's a big
jump.
And it does not have to be backed by anything. I can make a product tomorrow and get it at Target.
Yeah.
So is it like, should I just change it? Say I don't like the word professional or medical grade when it comes to skin and skin conditions. What word should I use? Is luxury?
No, I say professional. It's professional grade, like, and that's exactly what I said.
But what I don't like is how. What I don't like is how even with like it'll say dermatologist tested. They think, oh yeah, the dermatologist said. The dermatologist don't give a damn.
They don't test
and I feel
nothing.
like that's just a label that you can slap on.
It is though. It's
like
regulated.
I can put anything on my label. I can put esthetician made by esthetician. You can put whatever you want on your label because it's your label.
It doesn't make it true.
Yes. So I wanted to just get in because I feel like for the people that we see that's most common with eczema, rosacea, psoriasis, but
common skin conditions in our community.
Yeah, so that treatment has been like my favorite, and I'm so happy that we kind of talked about this. The only thing I haven't been able to like really is a seborrheic dermatitis. I mean seborrheic
dermatitis.
No, I'm saying I didn't mean to say
atopic.
No, not atopic. I haven't. I just seen that with the one guy. He stopped using the dye.
Okay.
And then my client he stopped using it. That was only with men. I haven't seen that with women.
Okay.
Oh yeah.
You seen it with women?
Yeah.
And I haven't seen HS in person.
I have a lot of clients with HS actually.
Yeah. But I'm like, how are y'all? Like, what are y'all doing to soothe that?
What HS?
it's nothing you really can do. Like, you just have, it's all about, honestly,
it's
protective
and lifestyle. But like benzoyl peroxide wash is good because it's anti-inflammatory. Depending, right? They're darker skin. I'm not giving them that.
So let me ask you something. I was about to say, so let me ask you something. All right, so a client comes to you with it, right? And instead of, so for me with the benzoyl, I know the benzoyl peroxide wash is good, but I feel like you washing it right off. I would rather put them on the cream because it's something that's sitting in the skin.
Yeah.
Right?
But a lot of times when clients first come to you and they don't have HS, you don't know they have HS until about 12 appointments down the road.
No, I'm not even just HS. I say like butt acne, you know?
I don't have people telling me they got butt acne.
You don't?
No.
I be honest, I'd love to treat that more.
Absolutely.
Because that breaks a woman's confidence.
And it's a lot more factors when it comes to butt acne than face because you know,
laundry detergent.
And like the friction of your underwear. You know, if you have a lot back there, maybe a little sweaty.
Yeah, I got a lot back there. You know, never sweaty.
I don't sweat a lot.
Right. Some people have an overproduction of sweat. Right. That's another condition. What is that? Hydronosis or something like that. It's when we have an overproduction of sweat.
And they get in their hands. It can be treated with Botox.
Yes. I forget what it's. A lot can be treated with Botox.
Yeah. Migraines, all that. But I'm excited. This was fun.
Yes. Oh, we didn't talk about the other one. The new one that we just found out.
Oh, Pemphigus. I forget how to pronounce it.
How we say it?
Pemphigus. It's hyperhidrosis.
I
know or something like that.
What's the other one that we just learned about? The one that it takes
Pemphigus.
And it takes the healthy skin cells and it creates blisters.
It's an autoimmune disease
that attacks the healthy skin cells and top creates blisters on the top of the skin.
And it creates blisters, and it's usually like in your nose and your mouth. I've never seen that.
No, I haven't either.
To be honest, I gotta dig a little deeper. I wouldn't even be able to recognize it. Yes. So I would be like, what was that?
Yeah, like I've never really seen that. I think, the only other thing we did not touch on, and really quick, because this is gonna kind of fall into an episode that we're gonna do specifically on hyperpigmentation, but like moles. Right?
Like
when you freckles and then like just moles. Like we have a duty as estheticians, right? And ethics come into play with that. That if you see something that may be abnormal, moles.
ABC. Yeah. Thank you. Yes.
Moles should not be irregularly shaped.
Yes.
If you see anything, especially if it's like flat, you know,
border is asymmetric border and discoloration.
Yeah.
Look at my textbook ass. Asymmetric border and discoloration. I told you I just closed my eyes and I just think about the page in the textbook.
You might got photogenic memory where you can close your eyes and like remember.
Yeah, because y'all notice when I talk to y'all a lot about skin,
you
close your eyes.
Yes, that's like photogenic memory. Yeah.
That's weird.
It's cool.
Yeah.
My cousin actually has it. It's rare. My cousin has it. Like, he can close his eyes and
I always say, I feel like I'm not really smart. I just have a good memory.
Yeah.
Like, I do. I be thinking like that. I be like, oh, because I just be memorizing.
I know a lot of people are like, well, how do you remember? I said, I don't memorize it's no protocol to memorize. I just close my eyes and look at the condition and I remember what to do.
Can I tell you what it is with me? With me, it's like if I'm passionate about it or if I care about it, I'm going to remember it. I'm going to learn it. But if it's like, you can tell me something about why the sky is blue. I don't really care. So I won't remember that.
But
see, I remember everything.
That's a foundation, though. Like, I feel like once you solidify that, like, once you have that strong foundation and you understand the skin, and I'll continue to stress it. Like, I told y'all before, like, I constantly test myself on the histology of the skin. You know, what happens in the epidermal layer, what happens in the hypodermis, you know, basal layer.
How did you do the testing? I think you mentioned it in the previous...
I just Google like histology.
Or I do
because I do
like
but I think a lot of nursing.
It was an app. I thought she was going to say it was an app that I used in school to help the study. It was something for estheticians only.
I did Quizlet.
Forget what it was.
I know there was an app.
It was an app. We were studying the shit out of it.
Yeah, I just don't reread the same thing twice. So once I know it, I know it. Yeah. And so that way when I go take tests, if I don't know it, I don't know it. But I have a good memory of just remembering
like you know what you know.
But also I'm hood. So I correlate things to other things. So if it's something scientific, I can remember the scientific justification of why this does this. Like I can talk when I have intelligent education with you guys. But if somebody don't know what I'm talking about, I'd be like, okay, take an analogy of butter. You put the butter on the stove, the butter melts there. Same thing with oil in the skin. You go outside, you sweat, that's butter on the stove. Then you put the butter back in the refrigerator, that's solidifies. There's your acne right there. I break it down in metaphor so I know how to have it. I don't know how
you break it in layman's terms so they understand it, make it more digestible.
I don't have a conversation with whoever I'm sitting around, so I pick up. Like, okay, because you can't judge a book by its cover. Right. That's my thing. Like, just because you want just because you want hoodie and sweats don't mean you're educated. No. And you have to learn. Like, I always say to myself, I don't want to sound dumb, but I don't want to sound perfect. So I put my hood.
Or like you're like,
so you're able to meet people at whatever level they at.
Yeah,
like
that's great.
Yeah, that's great.
I can tell you why Pompeii happened in history and why Jews did this. I'm just a
multifaceted. In education.
I'm an optical illusion. It's just appearing different than what they really are.
Whatever you fucking this was so fun, and to be honest, I really did have a good time. Just even studying some of these. Like I told you, like I know what HS is, but I've never seen it. So when I got to like Googling what it looked like, I'm like,
but I'm also happy that we like sat there. We actually planned out season 2, so that way we can get ahead of the curve and like actually
ahead of the curve,
educate ourselves before we come over and talk about it. Not that we don't know it, because we do know it, but sometimes when you go from school to working, it's just like stuff that I learned in school is on a back burner, and it doesn't come to you unless you're faced with it in front of you. So this is your guideline. This is you guys' blueprint. Okay, they talked about this season 2, episode 4. Let me go to that real quick because I got a client coming in.
Yeah, let me just go ahead.
So if we can make this a walk-in ebook or a walk-in textbook. I mean, our ebook is coming out. Yeah. Or in our physical.
You mean like a walking glossary or like a walking like fact check or
Hoodonomics.
Yo, I cannot.
This is skin hoodonomics.
But seriously, it really is important, and your skin analysis is crucial. Like if you're not conducting one, you need to start, and that's your opportunity to ask everything that you need to.
Yes.
Like,
and I think
get personal.
Yeah, I think that is very important to what you put on those intake forms, right?
Yes.
Because it's like, I've booked with people and they don't really have an intake form.
Like, I have one. I know that's weird, but I have one.
No, I got 2.
I got intake form.
So I changed. Mine was a job form, and it used to send you an email.
Like, I know mine. Yeah. That's annoying. I'm gonna switch to Google Docs.
No, look, I just on our Acuity. It's annoying because you got to do it, but I have a virtual assistant.
They do that.
Bro, you can ask 1,000 questions. Like
I did do one for wax.
Yeah,
I just haven't transferred my skin one over.
Girl, I got a girl that'll do it for you.
Okay,
$4 an hour.
Okay, send her to me.
That's my virtual assistant. That's my boo.
But
anyway, so wait, I wanted to say really fast before we go, vitiligo, right? So I have not had anybody come in with it, but I know people who have it, right? So my thing is, how comfortable are you treating? Or do y'all you treat
it like regular skin?
I know, but I'm saying
like we can't. That's not in our spectrum, regardless.
Yeah, I can't. But I'm not treating their skin for the video. Like, what if somebody that with vitiligo came in and they had a bunch of hyperpigmentation on the darker spot of their skin?
You treat it as regular skin.
Yeah, but I was curious to know how the skin responds because we have so much.
It will respond the same because here's the thing. The vitiligo is only affecting a certain part of the skin. You gotta think, you can treat the face in sections. I have people who come in with acne hair, hyperpigmentation hair, and cheeks is doing nothing.
Right.
You can treat certain parts of the skin. However, when you're treating those parts of the skin, you cannot cause a halo effect.
Right.
You gotta know when it's too much and too little. So you need to study your client and slowly build them up. Right. Slow and steady wins the race.
Right.
So if they have vitiligo and they have hyperpigmentation on the spot that is not suffer from the vitiligo, you treat it as regular skin.
Right. However, so like a spot treat.
Treat. However, you don't go full throttle and do a VI pill. Or you want it. You do something simple as like a baby lactic.
Yeah, like that. I was just curious because I don't have one of those clients. I don't have but I still feel like it's my job to like. What if somebody?
But then ultimately, vitiligo is taking literally melanin is being destroyed. There's nothing we can do for that as far as like. So that's why, like Krista says, you treat it as is.
Right? Like because it won't. It's already lost the pigment. So it's going.
The only thing they can do is out of our spectrum, lasers and stuff like that.
Yeah, do different lactics. You know, it's a lactic derivative from tomatoes. It's a lactic derivative from sour milk.
Right.
I would take the tomato approach rather than the sour milk because the sour milk can cause or erythema, it can cause blanching.
Right.
And you don't want that person to think, oh my God, she bleached my skin and now I got another vitiligo spot. So, no, I'm just saying.
Can you imagine? They walk out there like,
Right.
But it's all about, it comes down to ingredients, knowing your ingredients and knowing where they derive from, knowing how they are processed and how they are made. If you're playing with
I almost want a client with it.
Because I think the colloidal silver was a good ingredient that you had mentioned that's in the Honest Mom.
Oh, yeah.
Because I'm even thinking about it, like, even the Korean skincare has a lot of colloidal silver in it.
How do you feel about the oatmeal baths? Like, how people do that?
First of all,
school, but
I don't take baths. I take showers. Because the self-cleansing oven, it needs to self-cleanse. I don't need nothing going up there. That's why I don't get in pools. I don't do none of that stuff. So you will never catch me in nothing.
I be in a
oat milk. No.
Boiling yourself.
But ladies and gentlemen, that's how we act.
I love a good bath, girl. And I'm the type of
we have our spa day.
So much fun stuff. Go ahead, Maria. Tell them what.
We're going to a spa. Yes, you are.
You leaving there with something. You get in that pool.
My bedroom will be plugged like a bug. It's nothing.
We are going to a Korean.
Fuck no. I don't play. Like, people pee in the ocean. People pee in pools. I'm a princess. I am a goddess. Like, I don't want nothing.
Listen, if it's clean water, I'm a fish.
I'm me.
Yeah,
I'm a black woman who don't get her hair wet.
I go head first.
I don't even want to. I like my toes. Like, oh no,
we gotta warm you up, baby.
Yeah.
We gotta warm you. You've been all over the world and ain't been in the pool. No, that ain't vacation.
I'm from the Caribbean.
I am a mall girl. I am a Hermes, Chanel.
You can be most though. You can be tall. You can still be Chanel.
When I'm born, girl. No.
We are going to a spa, y'all.
We're going to the spa. I don't know how Krista will survive.
It's a Korean bathhouse.
Don't touch me.
She gonna come in a hazmat suit. And it's gonna be really fun. I think we picked. What did we pick for? 50? Oh, right before our launch party. Actually.
We get to wind down before the chaos.
Yes. So sometime in April we are gonna be going, and we're getting massages, and they have like different sauna rooms and stuff. So it's gonna be really nice. A different kind of like environment to do our podcasting.
We're gonna. I gotta figure out if there's a place where we could, because it's gonna be like echoey, because it's like in like those type of rooms.
Yeah.
But maybe we can just do a few episodes, like maybe
we could do content and then maybe go somewhere
and talk about
just kind of talk about it.
Okay.
Yeah. Nate, you're coming with us. Like, no,
we'll see you guys later.
Thank you guys so much for watching.
I'm doing the single heart old school style. I don't know about the crypto.
Nope. I still ain't fucking learn. Hold up.
No, girl, put the thumb in it. Put this arm.
And we're doing the wrong finger.
This is too much.
No, to put the thumb in. Put this finger down.
Okay,
there you go.
Yay!
Bye, guys.
Bye.